Hi, I'm Jennifer Hilliard, Public Policy Attorney for AAHSA. Among the many provisions contained in the healthcare reform law are several aimed at eliminating fraud and abuse in federal healthcare programs. Because most of these provisions are already in effect, AAHSA members should begin their compliance efforts now in order to avoid potential pitfalls down the road. First, compliance plans for nursing facilities likely will be mandatory. Under the new law, all new Medicare and Medicaid providers must develop and implement a corporate compliance plan as a condition of enrollment. However, it's likely that the Secretary of HHS will expand this requirement to apply to current Medicare and Medicaid providers as well. Corporate compliance plans are critical tools for providers to ensure that they provide quality care to their residents and do not violate complex regulatory requirements. If you do not presently have a plan in place, we urge you to begin developing one now. And even if you do have a corporate compliance plan in place, you will need to update it to comply with new requirements put in place by the healthcare reform law. The HHS Office of Inspector General in 2000 published guidance for nursing facilities to follow in developing and implementing a corporate compliance plan. In 2008, the OIG's office published supplemental guidance which significantly expands the scope of such programs. You can access these documents on the Legal Issues page at aahsa.org under the heading Governance, Ethics, and Corporate Compliance. Second, you will need a robust compliance plan in place to detect and resolve any Medicare or Medicaid overpayments that you receive. Under the healthcare reform law, any Medicare or Medicaid overpayments must be reported and returned within 60 days of being identified, or the date on which a corresponding cost report is due, whichever is later. The overpayment must be returned to the applicable government contractor, intermediary, or carrier. The failure of a provider to return an overpayment within the 60-day time period will constitute a violation of the False Claims Act, which can result in civil or even criminal liability. While the details of the overpayment provision will need to be addressed through regulations or guidance, the provision became effective on March 23rd of this year, so providers must be diligent in promptly detecting and returning any overpayments. For additional information on these and other important fraud and abuse provisions of the healthcare reform law, please visit AAHSA's Healthcare Reform Hub. Thank you.